Today I'm going to talk about alcohol, but what I'm going to say about alcohol is, I would say some of the things I'm going to say are similar with the other risk factors, particularly related to not what to do, but how to do it. Alcohol has a negative impact on every single person living in Europe today. Perhaps because of my past career, I'm often told that alcohol is not a serious problem compared to tobacco, for instance. And perhaps you have been told the same. But in agreement with the Oral Health Platform, we definitely disagree. Just as tobacco, alcohol, as I just said, is a major public health problem. Alcohol kills, and it also imposes enormous economic cost to society, both directly from healthcare needs and indirectly from loss of productivity, injuries, mental health, and secondhand drinking. So you see, the numbers don't lie. Alcohol kills 1 million persons in the European region every year. And when I say 1 million, actually, we have all these numbers and we don't actually realize what it means. What it means is that there are 2 persons who die every minute. 2 persons die every minute in our region due to alcohol. And these people include our kids. Unlike death related to tobacco use, our kids or friends of our kids below the age of 20. So with approximately 2 people dying every minute because of alcohol in our region, why are we still overlooking this great issue? And as I was saying, perhaps the question is not why, but who should and should not be responsible for dealing with this problem. And what I'm going to say now, I think, is related to the other risk factors. So I'd like to leave you with 3 messages. The first one is that I do believe with you, Mr. Rouillet, that actually EU policymakers are responsible for dealing with this issue. Number 2, we know what to do. We've got the evidence, whether it's tobacco, whether it's alcohol, whether it's sugar consumption. We know what to do. But the commercial determinants of health, so the alcohol industry, the tobacco industry, and to a large extent the food industry, should not be involved in the implementation of what needs to be done. And last but not least, I do believe that when it comes to alcohol, it's a plea for policymakers to walk the talk. And I'd like to introduce the idea for the first time here in the Parliament of a dry month for policymakers. We are all, doing dry January at national level. We are doing it currently in Belgium. But within the EU institution, no policymakers has taken the pledge. So it's my invitation to you to actually, launch a campaign to have a dry month within the EU bubble. Perhaps it would change the mindset of policymakers. So, as I was saying, number 1, but I also believe we all are responsible for dealing with the topic. Alcohol is no longer a topic that should be avoided. And the Manifesto of Oral Health is a very innovative, useful, and evidence-based document, which has been carefully and brilliantly designed. I mean, it's a brilliant document. It's the second part, but I would really invite you to read it because it actually says what to do. And as long as you don't work with the commercial determinants of health, it should stay on your desk and should not be forgotten in a drawer when you go home. And Eurocare offers its support to all of you to make sure that that becomes a reality. The second message is about the alcohol industry. And as I've been saying, the alcohol industry is everywhere at national level, at European level, and they are not part of the solution. Because when we want to implement, then the problem is that they are there and they actually lobby exactly against all the measures that we want to put in place. So there is extensive evidence that big corporations, tobacco, alcohol, food, affect people's health by promoting the consumption of unhealthy products, which create all health issues, as well as other NCDs such as obesity, injuries, mental health issues, and addiction. The term harmful use, which unfortunately ended up in the NCD report, was designed by the alcohol industry to blame people, and this has to stop. It is not the fault of the people. It is the fault of these big corporations pushing unhealthy products. And the main and biggest barrier to the implementation of evidence-based policies, including alcohol policy, is the alcohol industry. So the last point is walk the walk, and this idea of having a dry month. The real magic when you stop drinking for a month is that it helps people to drink more healthily throughout the year. Research has found that 6 months after dry January in the UK, for instance, more than 70 people who take on the month are still drinking more healthily. They drink less. And this is exactly what we want, even though the industry wants us to drink more. Obviously, they're a business. On top of that, they have boosted levels of well-being and much more besides. So how can it be that just a month off has a long-term impact? Being alcohol-free for 1 month, for 31 days in the UK and for 29 in Belgium, I think that's why the Belgians have taken the month of February. Yeah, well, maybe, it should be February. But it's not a competition even if those 29 days or 31 days, it's a plea to oneself to look at your relationship with your own alcohol consumption. But you concentrate on the benefits of drinking less. So it shows that we don't need alcohol to have fun, to relax, or to socialize. It helps us learn the skills we need to manage our drinking. And that means that for the rest of the year, we are better able to make decisions about when we drink and how much, so that we can avoid slipping into drinking more than we really want to. Because most of the European people, we all know deep down that, well, we have the figures, the European region is the highest level of consumption in the world, and most Europeans drink at levels which are harmful to their own individual health, including oral health. So to finish what I wanted to say, maybe I will invite you to close your eyes. It's a sort of little thing. All of you close your eyes. And I'm going to say, think of health. And what do you see? Maybe you'll tell me later. But very often when we think of health, we think of hospital, we think of healthcare, we think of actually how we deal with the problem. But health does not begin in clinics or hospitals any more than justice begins in law courts or peace starts on the battlefield. I did not invent this. This is Dr. Tedros. So it is his quote. So in conclusion, sometimes it takes a group of committed people to create a paradigm shift. I believe today is the time to create this paradigm shift. We know what to do. Don't trust the industry. I mean, the nasty industry, the tobacco, the alcohol, and the food, pushing forward. And let's implement the manifesto and let's work together. Thank you.